It's hard to talk about rectal cancer because it affects us in a way that is very personal. It affects a part of the body that you don't want to talk about. It affects bowel habits, which is not something that you want to talk about. But we need you to know that this cancer is treatable. We have surgery, we have chemotherapy, we have radiation, and we have targeted therapies. Rectal cancer is treated by a team of doctors. Initially, the gastroenterologist diagnoses the cancer, and then the surgeon gets involved to see if this tumor is indeed resectable. Also, an oncologist becomes an active part of the team because the oncologist administers chemotherapy and radiation therapy. If rectal cancers are found early and are small tumors, many times they can be just taken out by surgery and no further treatment is needed. If a rectal cancer is larger, this requires treatment before surgery. The treatment usually is a combination of chemotherapy with radiation prior to surgery to remove the tumor in the rectum. The reason why we use radiation in rectal cancer is because radiation helps reduce the chance of the cancer coming back. Chemotherapy is used in rectal cancer to kill the cancer. It's used to shrink it down prior to surgery, and it also has been shown to make people live longer with rectal cancer. The reason why people have symptoms with rectal cancer is because they have a tumor in the rectum that's causing an obstruction perhaps, or causing bleeding. So if we can shrink the tumor with chemotherapy, their symptoms improve. The main chemotherapy drugs used to treat rectal cancer include 5-fluorouracil, along with leucovorin, which is a vitamin. This vitamin helps 5-fluorouracil work better, oxaliplatin, irinotecan, and targeted therapies of bevacizumab, cetuximab, and panitumumab. Rectum is the lowest part of the large colon, and it's where the muscles of defecation are. And so if a cancer affects the rectum in the area of those muscles that affect defecation, in order for us to remove the tumor, we have to sometimes take those muscles during the surgery. That means that a patient will have to have a device called an ostomy. A colostomy is a surgery that is done to divert the colon to the abdominal wall so that the stool will pass from the colon outside into a bag. That's a colostomy. The treatment for advanced rectal cancer has improved greatly over the last few years. We now treat advanced patients with chemotherapy and also with targeted therapy. The targeted therapies that are used in the treatment of rectal cancer include one agent, bevacizumab, which blocks blood vessel growth of tumors. This agent, when given in combination with chemotherapy, significantly prolongs the life of people with advanced rectal cancer. If you are a patient with rectal cancer, you should ask your doctor if there are any clinical trials related to your disease. Clinical trials usually are testing new therapies, new drugs, new antibodies, new treatments, new combinations. It may be possible that a clinical trial exists for you in rectal cancer, either at your doctor's office or a nearby major academic specialized medical center. There are many clinical trials that are being done nationally to find new therapies to improve the quality and the quantity of people's lives who are suffering from advanced rectal cancer. Another antibody that has shown promise in the treatment of patients with advanced rectal cancer is in a class of antibodies called epidermal growth factor receptor blockers. These antibodies include cetuximab and panitumumab. These antibodies that block a growth pattern on the cancer cell have been shown to shrink tumors. They've been shown to lengthen the time it takes for a tumor to come back, and they've been shown to make people feel better in their treatment of rectal cancer.